Adherence and compliance is always a challenge with oral medications. It's a challenge for anyone, let alone if you're a cancer patient and you're trying to manage work and home and family. So one of the things that we have found to be a best practice is incorporating diary sheets. It can be the medication dosing diary sheet where we can add specific instructions on taking it with food, take it an hour before, 2 hours after eating, a place for them to document blood pressure if they're on a drug like axitinib or cabozantinib. We know that they're going to experience, there's at least a strong potential that they're going to experience hypertension that needs to have communication with the oncology team and needs to be managed. So giving them specific parameters for the systolic and diastolic blood pressure that should lead to a phone call to the oncology provider and having them write down their blood pressures. I don't want to know just today's blood pressure. I want to know what the last several days' blood pressures are, because it's really about the trend, not just an outlier. And so written resources and written diary sheets are something we found to be helpful, and they can document if they've missed a dose or they overslept and why they didn't take a dose. And that's helpful as well for us to know as providers as we talk about treatment plan and treatment goals. Megan, what are some things you do in your clinical practice for compliance and adherence?
Thank you, Laura. So I echo everything you say. I think for compliance and adherence on oral oncolytics, written materials are very important to give them at least a foundation to build on. Outside of actual materials, I think establishing that rapport and trust with the patient is foundation for making sure that there's honest communication, where you tell them, please let us know if you're having side effects, because we can, if we need to dose reduce, we can do that. And letting them know the purpose of why we want to know the compliance, I think is very important. And setting that foundation for why we need them to take it every day, so they have an understanding of building up therapeutic levels in their system. So giving them a foundation of information so that they understand why we need them to be compliant on the drug, but also keeping that door open so they feel comfortable telling us when they've held it. Because I have found through clinical trials, we've all seen diaries on the oral oncolytics there. You want to make sure that even what they're writing down is true, because they're all scared of disappointing someone, a lot of them, and being and speaking to them human to human and making sure they feel comfortable coming to you with a concern, I think is probably the most important aspect of compliance when you're talking about oral therapies. Virginia, do you have any tips you have for oral compliance?
Megan, you and Laura really covered that topic very well. I don't have much else to add, except that I would agree that for oral oncolytics, it's really helpful to have a calendar or a diary where patients can document any adverse events that they're having or the fact that they missed a dose, etc. And as you said, just keeping the communication open, that they understand everyone slips up, makes a mistake, forgets, or it's okay that they hold the medication. It's just important for us to know that. So I think both of you have fully covered that.